Hey, welcome back to Midas Letter Live. My guest this segment is Julian Fantino. My apologies. He's the CEO of Aleafia Health Inc., trading on the on the Canadian Venture Exchange under the symbol ALEF. Julian, thanks for joining us today.
My great pleasure. Thank you.
I feel like I should actually be still referring to you as chief, because you were formerly the chief of police of the City of Toronto.
I was indeed.
Tell me how you came to be the CEO of a company that advises people on consuming marijuana for medical reasons.
It hasn't been an easy transition, if you will, going from law enforcement to what now is in fact a health-related kind of enterprise, from our point of view anyway. And it was during my time as Minister of Veterans Affairs, where I dealt with a lot of veterans who had all kinds of health issues that were being medicated mainly through opioids and Percocet, Oxycontin, those kinds of issues, and they themselves were trying to get off of those items and trying to self-medicate and whatever. And the government was slow in responding to some of the advances made in the medical cannabis area. And so that's how I became interested. I set out to learn more, to educate myself, talk to a lot of people in the industry, medical people, scientists, and so forth. And I felt that and became very much aware of the medical properties and how much better a lot of these people were then treated with medically prescribed or medically assessed response through medical cannabis.
Do you find yourself dealing with a degree of professional criticism as a result of making what would appear in some cases to be an abdication from law enforcement to a dark side?
Well, yes, there are always those that looked at a negative, but I feel that this particular area of trying to help people and the work that we're doing and the work that certainly I've been doing all my career makes me, I think, a good candidate for change.
Sure.
I educate myself, I inform myself, I surround myself with people who provide in-depth and knowledge that can, in fact, help make good decisions. And I've done that, and I feel very comfortable being associated with a lot of the medical people, professional people who have looked to medical cannabis as a solution even to the opioids crisis, and as you know how debilitating that is. So
Sure.
I feel very comfortable in the decisions that I've made. I feel very motivated, knowing full well that this is really an early beginning, and yet much more to be done. So, and we're doing good.
Yeah, you bet. And let's focus on that. So Aleafia was formerly known as Cannabis, and the business model was essentially clinics where people who wanted to explore the possibility or the appropriateness of medicating with marijuana could go see a doctor who would advise them on how to proceed. Is that still the business of Aleafia, and how did Cannabis become Aleafia?
Well, there are actually two streams. We're totally patient-centric and patient-focused, and we feel as well that we need to look after our patients through the progression of their issues and post even our intervention, helping them or reconnecting with them. So we've also migrated out into a grow operation, a licensed grow operation, where we hope to provide quality product for our I guess, patients and so forth through the clinics and all of that. And at the very same time, make sure that there's certainty of product. As you know, there's always variables about whether or not there is or there isn't. Like going to a drugstore with a prescription. You don't want the druggist to say to you, I'm sorry, what of this or what of that? So we want to be able to look after our patients through the clinics, through the medical assessments at the front end, of course, migrating through a selection of product and helping them adjust to that product and helping them make corrections along the way. And the gatekeeper in all of this is always a medical person.
Okay, so then Aleafia is also in the process of becoming, or is now an ACMPR grower as well.
Yes, we are, and we'll be probably taking in our first harvest within 4 or 5 weeks.
Wow.
So we're not big in the sense of how others are in this space, but we feel that we want to make inroads in the science, the research as well. There's a lot of work to be done in that area, the education piece, trying to get. And that's one of the huge issues that I discovered is the lack of good sound information about the good qualities, the medical properties of the plant, if you will, when used medicinally and all of that. with what is very often perceived and stereotypical visions that people have about pot smoking and all of that.
Right, right.
So we will be into a grow very soon.
Okay.
And we're working as well with other folks who are like-minded in terms of quality, the assurance of a good product, obviously the whole availability issue. We're very, very committed to rules, regulations, policies, and standards, and of course obeying the rules of the land.
Sure. Okay, so one of the greatest arguments for the legalization of medical cannabis as an alternative to opiates is obviously driven by the huge amount of opiate addiction and opiate overdoses that are occurring right now at almost crisis levels. So what is the experience from your perspective, from Aleafia's perspective, of the effectiveness of cannabis in alleviating, first of all, addiction, and secondarily overdoses?
It's a very good point that you raise. Cannabis is already going through a 1,000 patient study looking at the opioids crisis and options to opioids. And so that study is about a third way through now. And we're very encouraged by the results, where we are able to see the very positive effects that are derived from medically prescribed, medically ordered cannabis, and getting people off of opiates. And we know the devastation of opiates, of course, so we kind of made that one of our objectives through more research, obviously more involvement with the medical profession and all of that, but that's one of our goals.
Okay, and how many clinics now does Aleafia operate across the country? How many patients use your services?
There's 22 clinics across the country. There's obviously expansion plans underway right now. And the patient number is around 40,000 patients that we now look after. And the intake is quite significant on a monthly basis as well. And you know, it's all a matter of people becoming more aware of the actual science behind it all, and more medical practitioners learning more about how they can in fact help their patients with a better treatment, if you will, or more effective treatment when it comes to things like chronic pain management, sleep deprivation, anxiety, all those kinds of issues, post-cancer treatment kinds of response. So we find that the medical practitioners themselves are finding it much more helpful to help them deal with their patients' issues, health issues.
Wow. Okay, and so what is the timeline till the company becomes a profitable entity?
Well, we obviously, like every startup, we're very new. I'd like to tell the story that about a year and a half or so ago, we didn't even have a telephone. So we've been ably assisted by family, friends, and supporters that have got us to this stage in our growth. And so I would say that probably within the next quarter or so, we should be rounding the corner.
Well, that's great. That's an excellent introduction, Julian. Thank you so much for coming in today. We'll follow up with you in due course. Thank you again.
Thank you very much.